So as 2019 was wrapping up, someone contacted me because they wanted a quote for an article they were writing. And their question was to me, this last decade as 2019 was ending, what is the biggest medical advancement that's occurred? And what's your prediction for the biggest medical advancement of 2020 and beyond? And my answer for both those questions was the same: immunotherapy. It's a word that a lot of people haven't really heard of, but it's the biggest revolution in medicine in modern times. And I think it's worth discussing. Now, the funny thing is that when it comes to health and news, there's so much hype around about miracle cures and the revolution that's going to come along because of technology and biotechnology. There's a lot of hype. But as far as I'm concerned, with immunotherapy, all the hype has been lived up to and more. So the concept of immunotherapy is very simple. We're going to use a medication to either activate the immune system or to suppress the immune system, depending on what disease we want to treat. And the two big applications for it at the moment are the treatment of cancer and the treatment of autoimmune diseases. So the way that cancer gets treated is there's options such as surgery and radiotherapy, but a popular option is chemotherapy, where basically you give medications to kill the cells you don't want, in this case, the cancer cells. And it works very well. The problem is, though, that chemotherapy also tends to kill cells we want to preserve, like cells that control hair growth, or the cells on the inside lining of our gut, or the bone marrow. So it can cause a lot of problems because it's not targeted. And this is where immunotherapy comes in. Immunotherapy doesn't actually kill cancer cells. What it does is it flags cancer cells to our body's own immune system, so the immune system goes ahead and takes out the cancer cells. So cancer cells are very duplicitous. They're clandestine, and the body can't actually tell that they're abnormal cells, and that's how they can evade our immune system. And this is a way that they can't evade our immune system because the immunotherapy is there, it's activated, it's triggered to target out and seek and destroy these cancer cells. The other way immunotherapy is used is for autoimmune disorders. So when we talk about autoimmune disorders, what we're talking about is the immune system, which is made to normally block out things like bacteria, funguses, and viruses, instead of attacking just foreign things, also starts to attack your own body. Autoimmune, that's where the word comes from. For example, for me, I've got an autoimmune disorder called ankylosing spondylitis, where my body's own immune system attacks my joints, causing what we call an inflammatory arthritis. So there's joint pain, and they start to fuse, and there can be permanent disability because you just kind of fuse together. Your spine can't really bend. So the way that immunotherapy works here is by suppressing the immune system. So when we talk about the immune system, we're talking about multiple different chain reactions. One chemical triggers another, which then causes the end immune response. The way that immunotherapy works in this context is it targets one of those steps, one of those chemicals, one of those molecules, and it deactivates them. So the immune response you're getting at the end from this autoimmune process, this thing we don't want to happen, it gets dampened because one of those steps is now being inhibited or dampened in some way. So this is how immunotherapy is used. It can be activated to kill cancer. It can be used in a way to dampen the immune response if we have an autoimmune disease, things like diabetes, or in my case, ankylosing spondylitis, or things like psoriasis. So for me, that's my big prediction for the next decade going forward. It's already done so much, but immunotherapy is going to change so much more in the field of medicine.